Hello guys, in this video we are going to study about Perthes disease versus SCFE, slipped capital femoral epiphysis, right? So these two are diseases that actually happen in boys, right? More or less commonly in the same age group, and they present almost with the same clinical feature, right? So it is very important that you know how to differentiate between these two topics, because questions are very important about SCFE and Perthes both, right? In clinical scenario, just a word, just a single word can change your diagnosis, or just the age of the patient can change your diagnosis. So although I'm going to discuss everything about Perthes and then everything about SCFEs in a very short manner, I will try to make it short, but at the end I will tell you what actually will help you to solve this particular question, right? So let's start. Perthes disease. So what actually is Perthes disease? Perthes disease is idiopathic. Perthes disease is idiopathic spontaneous osteonecrosis or osteochondritis of the femoral head, which means that we don't know the cause and it is spontaneous. Osteonecrosis or osteochondritis, you know the meaning, of the femoral head. Very important, of the femoral head, not femoral neck, right? What is the age group that it is seen? The age group is 4 to 8 years. Now this is something very important, the age group, remember it, right? Then what is the sex? Sex is males more common than females. So for example, if a 5-year-old male comes to you with a similar presentation, with a presentation just like Perthes disease, then what will you diagnose? Of course, Perthes. I will discuss this particular thing at the end. Right, next thing, most common cause of osteochondritis is Perthes disease, right? Perthes disease is the most common cause of osteochondritis. Next thing, more than 6 years. If the age of the patient is more than 6 years, then it means that the prognosis is poor, right? Poor prognosis if more than 6 years. Now, another very important thing, it can be bilateral in 10 to 12% cases. It can be bilateral in 10 to 12% cases. It is generally associated with few disorders, right? First one is protein CS deficiency. Protein C and protein S deficiency, right? Protein C and protein S deficiency. Extremely important. I am marking it nicely, right? Extremely important, protein C and protein S deficiency. Next thing that is important is thrombophilia, right? Thrombophilia. Okay, so these two are very important causes of Perthes disease. Okay, in a question, in an orthopedics question, if the age of the patient is between 4 to 5 years and the patient is a male child, then and in the question stem they are telling you it is present that protein CS deficiency, you can see the word protein CNS deficiency, then straight away the answer is going to be Perthes disease, right? So this is that word that actually changes your diagnosis, or gives you the diagnosis clearly, right? Protein C and protein S deficiency. Now what actually is the pathogenesis of this particular disease? See, what actually happens, that first of all, the vascularity of femoral head is gone. Vascularity of femoral head is gone. Why? Because of these reasons, right? Protein CS deficiency or thrombophilia. What is protein C and S? Protein C and S are those proteins which actually break the clotting factors, anti-clotting agents. Protein C and S are anti-clotting agents. So if there is a deficiency of protein C and S, what will happen? Other clotting factors will rise up, right? They will increase in number and they will have a lot of action. Because of that, what will happen? A clot will form, and because of the formation of the clot, a thrombus may form, and it will decrease the vascularity of the femoral head, right? That's why what will happen? Avascularity will occur. Avascularity. Now, because of avascularity, what will happen? The femoral head will break into fragments. This is called ischemic fragmentation. Ischemic fragmentation of the bone. Ischemic fragmentation of the bone, right? Now what will happen, that the bone will do attempt to regeneration. The bone will try for an attempt to regenerate. If the regeneration attempt was occurred nicely, then again it will revert back to a normal condition, okay, spontaneously. But if that doesn't happen, regeneration doesn't happen, then it will lead to secondary osteoarthritis. Right? And it can lead to coxa valga, magna, breva, plana. It can lead to many types of things. So this pathogenesis part was actually not important. What actually is important is your associated part. I just gave you this particular part so that you can understand it well. Now what are the clinical features? Painless limp, extremely important. Painless limp. Always see in the question if there is painless limp or not. Painless limp, extremely important. It is not painful. It is painless limp after activity. Painless limp after activity. Then there is limitation of abduction and internal rotation. Right? I am marking it again. I am covering it in box. Abduction and internal rotation, right? So that you don't forget it. I will read it as Abir, right? Abir. Abir means AB, abduction, IR, internal rotation. So there is limitation of abduction and internal rotation, right? Limitation of abduction, internal rotation, right? Which means that the leg will actually be an adducted and externally rotated phase. Got it? So there is limitation of abduction and internal rotation. What is the investigation of choice? The investigation of choice is nothing but MRI. Of course, it will be MRI because you won't be able to see these cartilaginous structures in X-ray, right? And what is the treatment? The treatment is mainly to contain the femoral head inside acetabulum. What will happen if we contain the femoral head inside the acetabulum? If it remains inside the acetabulum, what will happen is that the vascularity will be intact, right? So we can use cast over here. Some type of cast are there. First is Petri cast, or there is broomstick cast. Petri cast, or there is broomstick cast, right? Got it? So this is the thing that was important about Perthe's disease, extremely important. So the question about Perthe's disease can be like, a patient 5-year-old male came with limp in his walk after activity. On asking the patient if it is painful, he told that it is painless and there was no tenderness, and there is a limitation of abduction and internal rotation. He also had a deficiency of protein CNS, right? So if in this particular stem, there are so many things that is actually pointing you to the diagnosis of Perthes disease. First one is limping, painless. Second one is, I told you, abduction and internal rotation limitation. Third one is protein CNS deficiency. Right away, protein CNS deficiency, which means Perthes. And second, age. And lastly, age, which is extremely important, 4 to 8 years of age. Right. Now we come to SCFE, slipped capital femoral epiphysis. Now, what happens in slipped capital femoral epiphysis? That in this particular disease, the epiphysis in the bone, at the ends there is epiphysis, and these epiphysis actually get slipped, right? Slipped. It looks like a fracture, and it generally happens in children, right? And when there is epiphyseal fracture, epiphyseal disintegrament in children's bone, we use Salter-Harris classification. So SCFE is actually type 1. SCFE is actually type 1 Salter and Harris classification, right? In this, what happens? The split fracture at the growth plate. The split fracture happens at the growth plate. Honestly speaking, there is actually no fracture in SCFE. Just the epiphysis gets slipped, right? You put two things together without putting Fevicol in between them, and they slip down, right? That is actually SCFE. There is no fracture in between them. Okay, so let's study about this particular topic. SCFE. Head remains inside the acetabulum. Head remains inside acetabulum, right? The head will remain inside the acetabulum. The head is not going anywhere, but the neck is actually going somewhere. Neck is shifted, right? Okay, so it is a very important thing that is asked. Head remains inside the acetabulum. Neck of the femur slips. It can be bilateral in 60% of the cases, right? And it is associated with endocrinopathy. Okay, endocrinopathy. The most common cause is although idiopathic. Which means that I don't know, right? In endocrinopathy, what type of endocrinopathy is the cause? The most common endocrinopathy is hypothyroidism, right? The most common cause is hypothyroidism. So if in a patient you see hypothyroidism and features are like Perthes disease, which means that the disease, your diagnosis is not Perthes, it is actually SCFE, right? Most common cause is still idiopathic. Okay, another causes are increase in growth hormone and decrease in sex hormones, right? So why increase in growth hormone and decrease in sex hormones cause SCFE? It is very easy. See what happens, that there is sex hormone. What does sex hormone do? It fuses the growth plate, right? And what does growth hormone do? Increase the bone growth in length, increase the bone growth, right? Increase the bone growth. Sex hormone fuses and growth hormone increase the bone growth. Now what will happen if the sex hormone is less and the growth hormone is more? What will happen if the growth hormone is high and the sex hormone is low? See, fusion will not occur, and growth will go on increasing. The growth will go on increasing and there will be no fusion. That is the problem, right? That's why the bone will grow, but the epiphysis will not fuse, and because of that, it will slip out. That's why SCFE occurs, right? Very easy, right? No one is going to ask you the pathogenesis, just for fun I told you. Then risk factors. Risk factor is increased weight. So if the weight of the boy is very much, then it is a risk factor for SCFE, right? Then what is the most common age group? The most common age group is 12 to 16 years, which means puberty, right? 12 to 16 years, which means puberty. What are the clinical factors? The clinical features, sorry. The clinical feature is again same as that of Perthes. Limitation of abduction, limitation of abduction and internal rotation, which means again Abir, abduction, internal rotation, limitation, right? Very easy. Then the history of excess BMI, there will be history of excess BMI, young puberty group child, young puberty age group child, right? What is the investigation of choice? MRI. Now in MRI there will be actually a sign which is called Trithoven's sign. Trithoven's sign, right? What is Trithoven's sign? I am not discussing completely about Trithoven's sign. I am only making you write the name and what actually it is. In Trithoven's sign, the Killen's line doesn't intersect the femur. In Killen's line doesn't intersect the femur, which this is called Trithoven's sign. And where it is seen? It is seen in SCFE, right? So I'm only making you memorize the name and what it is. I'm not making you understand this particular thing now. What is the treatment, right? Close reduction plus internal fixation, close reduction plus internal fixation with in situ pinning, right? No one is going to ask you the treatment. They are only going to ask you the diagnosis, right? So now comes the most important part and last 1 minute, which will actually make you help diagnose it. The most important 1 minute of this whole video. Everything else was actually useless, to be honest, right? So first of all, in SCFE, what will happen? The puberty group child, right? In Perthes, the boy will be 4 to 8. Weight will be very high, excessive weight. Weight will be normal. Present with painless limb and ABIR limitation, which means Abir limitation, which means that abduction and internal rotation will be limited, right? In both these disease, this is common feature, like ABIR limitation. But what actually will help you differentiate in Perthes disease? Protein CS deficiency is present, right? And here it is hypothyroidism. Right? So that's it, guys. This is how you will differentiate SCFE and Perthes. First, you will see the age, and second, you will see hypothyroidism and protein CS deficiency. Nothing else is important. And extra added point, if you see weight is high, which means SCFE. Right. Thank you.